A patient died at the VA hospital in Aurora after the technician monitoring their vitals changed their alarm settings and placed a communication device on Do Not Disturb. That's according to a new report from the VA's Office of the Inspector General. The patient was in their 60s, had a history of lung cancer, admitted to the hospital in the spring of last year for shortness of breath and low oxygen. 2 days into their hospital stay, the report found the monitor alarm, which tracks heart rate, respiratory rate, blood pressure, and oxygen, sent out 4 alarms over a span of 6 minutes. The patient was found without a pulse nearly half an hour later and then pronounced dead. There's no documentation on anyone notifying nursing staff about the alarms during that time. Another worker reported the technician had a habit of disabling alarms, changing their parameters, and placing them on Do Not Disturb. The report found hospital leadership became aware of those workers not properly responding to alarms in September of 2022 and sent out a list of expectations 2 months later. But the report expressed concern about the lack of oversight. We reached out to the VA for comment and are still waiting to hear back.